for years now, I've seen, because I've done so many referrals for ketamine, and patients like Annabelle come back to my office and they talk about their experience. Why is it that more psychiatrists don't talk about it?
Mhm.
Someone like Annabelle, who had been in therapy, who'd been on medication for many years, she had never heard of it. 99% of my patients who I offer ketamine to, they've never heard of it. And when I call their psychiatrist to get permission, I call them like, your patient is literally on in my office on the floor crying. She's dysfunctional. She's curled up on the floor. What should I do with her? And
Mhm.
he told me, he's like, well, tell her to come see me on Monday. What do you mean come see me on Monday? She's on the floor, crying. She can't even get up. And what I did, I took her keys. I basically put her in a car and I sent her to the ketamine clinic.
Mm.
And this woman, if you see her now, just like Annabelle, like nothing happened. But this doctor was so resistant because I kept saying, why can I send your patient to ketamine? He's like, it's not going to work.
Mm.
Why so much resistance?
It's a very good question. I think, part of that answer is our guidelines are slow to develop and change with anything. Also, authorities in the field of psychiatry, they're probably waiting for more and more and more results to come out for them to be able to put their stamp of approval. There's a lot of politics involved as well. So think about 45 million Americans are receiving prescription for antidepressant medication. And 21 million people in America have major depressive disorder. That's roughly 8.4% of the population. And in terms of suicide, 50,000 Americans took their life last year. Think about
But
it.
that's what I'm talking about. Like
Well, we're having a mental health crisis in our
but
We do,
I've
country.
sent
yes.
patients with suicidal ideations to your clinic and they come back 3 weeks later, like nothing happened. I mean,
Sure.
the change is shocking.